examiner. This is my GMC number. Shall I proceed to my task? Hello, Mr. Vishal. Hello, Mr. Vishal. I am Dr. Mohan, one of the doctors in this department. I heard that you have injured your back, is that right? I'm really sorry about that. I'm going to examine you, and for the purpose of examination, you need to undress fully. You can stay in your briefs, and I'll ensure adequate privacy and ask my examiner kindly keep a sharp. Is it okay? Could you please stand up with the outstretched hands like this? On inspection, both the shoulders, both the anterior superior iliac spine, both the knee joint and medial malleoli are symmetrical in position. I couldn't appreciate, I'll be verbalizing my findings to the examiner, so kindly bear with me. I couldn't appreciate any exaggerated lordosis or any kyphosis. Could you please move a bit forward? Thank you. I couldn't appreciate, I'll be going behind you now. I couldn't appreciate any scoliosis, I couldn't appreciate any redness, any swelling, any bony deformity, or any muscle wasting on the back side. Now I'll be touching you for the purpose of examination. Just let me know if there is any discomfort. Okay? Do you need any painkillers before proceeding?
No.
Thank you. I couldn't appreciate any localized rise in temperature. Now I'll be touching you a bit deep. Tell me if there is any pain, something like that. Okay? Could you please turn your neck towards the right side? Thank you. Did you feel any pain?
Yes,
Okay. My patient is having tenderness on spinal palpation in the lumbar region. Could you please turn your neck towards the right side? I'm very sorry about that. Shall I continue?
Yes.
Are you alright?
Yes.
My patient is also having tenderness on paraspinal palpation in the lumbar region. Now I'll ask you to perform some movements. Is that okay?
Yes.
Could you please bend forwards and touch your foot with the fingers? Okay, thank you. Flexion is normal in my patient. Could you please bend backwards? Thank you. Extension is also normal in my patient. Could you please slide your hands and touch your knee joint like this? Thank you. Could you please do it on the other side? Okay. Lateral flexion is limited on the right side in my patient. Could you please sit at the edge of the couch and hold your hands on the hip and do a sideways movements like this without moving your head. Okay. Lateral rotation is limited in my patient. Could you please lie down for me? Thank you. Now I'll be slowly lifting your leg. Tell me if there is any discomfort, okay? Okay, I'm really sorry about that. Straight leg raising test is positive in my patient at 30 degrees angle. Now I'll be slowly bending your foot. Oh, I'm really sorry about that. LASIK test is also positive in my patient. Ideally, I'll do the femoral nerve stretch test to rule out the lesion of the femoral nerve. Mr. Vishal, this is a wisp of cotton. It will be feeling like this. I'll be touching at various parts of your leg. Just tell me if you feel this sort of sensation. Is that okay? Could you please close your eyes? Thank you.
Yes. 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 Yes.
My patient is having loss of sensation on the in the region of L4, L5, and S1. Sorry, and on the right side. Mr. Vishal, could you please push towards me? Pull towards you. Pull towards you. Could you please bend your knee joint? Thank you. Could you please push towards me? Could you please extend it? Could you please push up? Thank you, Mr. Vishal. You have been very cooperative. You can now press up. My patient is having disc prolapse. Probably the level of lesion is L3, L4, L5, and S1. Thank you. Ideally, I complete my examination by doing a complete neurological examination and also rectal examination to assess the anatomy. Thank the examiner.
The level of disc prolapse?
L3, L